All right, so share screen. Share. How does that look now?
Maybe everybody can mute themselves, but Rachel.
Can you see it now? Okay,
Yes.
I'm going to go and try and advance that. Does that work?
Is that the webinar is now streaming live? Is it the case? Yes, it is streaming live. Absolutely.
Is it live now? Okay.
Yes, right. It works now. Perfect. Great. So I'm going to launch it here as well.
Okay, awesome. Right, good afternoon, everyone. And well, good morning, afternoon, evening. We have people from different parts of the world. So welcome and thank you for joining us for this last webinar in our series of webinars that have been going on for a whole week. It's been a powerful week full of packed discussions. And this is the last webinar, which is entitled Addressing Global Socioeconomic Inequalities in Neuroscience. And I'm sure you agree with me that this is an important conversation to have. I will be introducing our panel in a bit. But before we do that, I would like to introduce the organizations that have made this webinar possible. So this webinar is brought to us courtesy of the ALBA Network, who are the main organizers, but funded by IBRO. The president of IBRO, Professor Tracy Bale, is with us today. So she will be introducing IBRO fully, but I'll start with telling you about the ALBA Network. So the ALBA Network was created to promote equity and diversity in brain sciences. And the goals of ALBA are to recognize implicit bias and discrimination and to provide better visibility, as well as professional development opportunities to scientists that are coming from underrepresented groups. And so the network now boasts of more than 1,500 members coming from 88 countries. Such great impact. So if you'd like to get involved or simply support the cause, you can become an ALBA member. And guess what? It's free. This is one of the societies or organizations where we don't ask you to pay for anything. Just sign up with us. You can go on our website. You can follow us on these different social media platforms. Our activities are sort of arranged or grouped in these 4 categories, which is awareness and advocacy, visibility and recognition, data and resources, as well as networking and mentoring. But basically what we are about is opening forums like this particular forum that we have today, which is a webinar or panel discussions on addressing region-specific diversity issues, as well as hurdles that people are facing in their different regions. We also advocate for inclusive research, and we have established awards to recognize outstanding contributions from researchers in underrepresented regions. We also like telling success stories of individuals, but above that, we also collect data in DEI, and we believe in a data-driven or evidence-driven DEI approach. And then outside of that, we also host major events at major conferences. So if you would like to host a DEI event, please get in touch with us. We can help you. We can give you resources. We can give you support. One of the things that we've also done is to openly declare what we believe in. So we as ALBA believe that we're all biased, and we've come together to now say, what can we do? So the ALBA Declaration is a pillar of ALBA's actions. It is a resource for concrete, positive, and evidence-based actions that individuals and organizations at any level can take up to promote equity and inclusivity. We have almost 700 people that have signed up. So I would like to invite you, if you haven't already done so, to read our declaration and to sign it and to join the right side of history in neuroscience. In direct link with the topic of this webinar that we're going to have today, ALBA is also producing a podcast mini-series this year, which is designed to provide a broader audience with exclusive insights into the topics covered during this ALBA-IBRO Diversity Week. And so I would like to invite you to this podcast series as well. When it is launched, you will see us on our social media sites when we are now launching it. I would like to end by thanking our funding partners. As mentioned in the title earlier on, this is funded by IBRO, this particular webinar, but ALBA and all of its activities are proudly supported by IBRO, FENS, Society for Neuroscience, and so many other funders. We would like to thank them for making our work possible. We also have partners and collaborators, and we would like to thank them for collaborating with us and making our activities possible in different regions. All right, so that is that about ALBA Network. Tracy will speak to IBRO in a bit, so I will not be introducing IBRO at this point. But I'd like to go straight to sort of the idea behind this webinar, what we want to talk about, and set the background at least so that we know the questions we want to ask. So if you've ever been a reviewer or a funder or if you're in publishing, one of the things that you quickly see in any field in science is that the ground is not level across the different regions. And so we asked ourselves the question, why does that matter? Does it actually matter that, the ground is not level, that there are differences? Now, I saw this little quotation that says, and it's from a paper or a study that I'll be sharing in a bit, that says the higher an individual socioeconomic background, the more likely they are to work in science, which means that socioeconomic status on its own can be a determinant of whether one joins neuroscience, thrives in neuroscience, is able to perform in neuroscience, stays in neuroscience, and is recognized in neuroscience. So that's why we decided that maybe perhaps it's worth discussing the impact of socioeconomic status on neuroscience research. Now, there's this study that was carried out in the UK. I know that most of us, the scientists, and you guys are really prone, you love data. So I brought a little graph here with a little bit of data that can just set the setting for us. So this is a study that was done in the UK, and they were looking at science and engineering students or science and engineering workforce and asking them questions about their background. And what they found was that there was a strong correlation between the socioeconomic background and the pursuit of a science-related study or field, like science and engineering in this case. And if you're looking at this graph, this is showing children that eventually entered into the science workforce versus the age at which their parents left continuous full-time education. So it was basically looking at, how far did a parent go with their education and how does that affect whether a child will join the science workforce or not. And what you observe is an almost linear gradient relationship that is proportional. And it shows that socioeconomic background does affect or determine whether a child joins science or not. So our question to ourselves today for this webinar is there a correlation between socioeconomic status and success in the field of neuroscience? I think that's a no-brainer. But if there is a correlation, what would it look like? What are the lived experiences of neuroscientists living in low socioeconomic settings? How do funders, research organizations, publishers, etc., look at this? And how does it inform, or how should it inform our efforts at supporting scientists from different regions within the world? And so I have a powerful panel of speakers that I've brought here with, coming from different settings, really. One of the things that we wanted to do was to make this a global reach, give this a global reach. So we've got a representative from almost every region within, in the world, every continent. And then in addition to that, we also brought in stakeholders in neuroscience research. We've got research organizations like the International Brain Research Organization, and the president, Tracy Bale, will be speaking to us. We've got publishers, and representing publishers, we've got Gail Rodney from Elsevier, and then we've got funders. And representing funders, we've got Samantha Palmer from the UK Research and Innovation. And then we've got actual researchers coming from low socioeconomic settings who either come from or are in low economic settings. So we've got Ubada Sabad, who's from McGovern Institute. And then we've got Aitana Grasso-Cladera, who's from Universität Osnabrück in Germany. And then chairing this session with me is Jacques. And Jacques is from Chinese University of Hong Kong. He is also a member of the IBRO Early Career Committee, as well as a member of the ALBA Webinars Working Group. And my name is Rachel Dangarimbizi. I'm from the University of Cape Town in South Africa. I am part of the IBRO Directorate, ALBA Directorate, but also a part of the IBRO African Regional Committee. So that is the composition of the panel that will be speaking to us. Now I will hand over to Aitana, who will share her experience with us. Aitana, take it away.
Thank you, Rachel, and also thank you to ALBA Network and IBRO for putting these relevant topics on the table and inviting us to talk today. Well, I don't know if this is like the reality of all Latin America or even South America, but at least I can speak for Chile, which is my background. And I think that the first issue that comes to my mind is the cost of studying. This is not only related to neuroscience or cognitive science, but it's like access to education. So it's not only not easy to get into the university, but once you're there, I don't know, semester fees, for example, are really high. And I don't know, if I compare what I pay for my bachelor's, for example, for how much I'm paying now for my PhD, is almost 9 times the amount of money, for example. And even if you contrast that or compare it with like the national reality and the minimum income, it is almost impossible to think about enrolling at university without needing to take a loan. So for some families, for some people, it's not even a possibility. And if I will have to think about academic barriers more related to neuroscience and cognitive science, we have no university that offers an undergraduate program in cognitive science or neuroscience. So you have to study something else. For example, I study psychology, and then I had to do another degree, like a master's, which is related to cognitive science. And this is kind of like starting with the wrong foot because, for example, psychology has a very important clinical emphasis, at least in Chile. So basically it's quite different from cognitive science. And even then, like not all the universities have graduate programs in this area. So it's like there's a lack of formal education in cognitive science and neuroscience field in Chile. And I think that this is something that we can see very often. I don't know, for example, when we sometimes do reviews, we find that the Global North has a bigger presence and we are not there publishing, we are not there collaborating, or even in like, I don't know, international conferences, we are lacking this participation. And I think that this is like quite relevant because we're trying to build laboratories, we're trying to get people interested in the field, raise new questions that are, I don't know, socially and culturally situated, but we are not being able to train and educate our students in this topic. So I think that that's a big issue. But even if you do your bachelor's in something and then you ended up somehow getting into cognitive science or neuroscience, from my perspective, and I'm not quite sure how to explain this, but I think that there's like a tendency for graduate programs to be more orientated to clinical and professional development than in comparison to like having an academic career. So the investment in education and the programs that are validated by the university boards are mostly pursuing a non-academic job-related outcome rather than developing a career, an academic career. So these programs that are based in research, methodologies, and other related topics usually do not get approved or do not get enough funding to keep going, which is like a big issue. And it's super closely related to, we have this situation, which might be also present in other regions, but this governmental investment in research, science, and technology. So some governments do not invest enough money, which is reflected in fewer possibilities for access to funding for research, for example, scholarships, and even less investment in these research programs. And I think that one last idea that I would like to share is not about my personal experience, but something that I've seen with my other colleagues, because now I'm doing my PhD, but I'm in Germany, so my situation is quite different. But if you're doing a PhD in Chile, I think that we have like this cultural issue where we have no culture of research, actually. So doing a PhD is not considered a job, not even like a part-time job. So people need to have another job, probably a full-time job, to be able to cover expenses of life, basically. And then it's like doing a PhD is something that you do whenever you have time. So it's like something that is like a hobby, like you do when you have your free time. So I think that that's also an issue because it can take longer. For example, programs usually are like 5 years. So if you're having another job, you can take longer to finish your PhD. And I think that is because of this like lack of research culture. And even if you're lucky enough to get a scholarship, for example, the income is not enough. So you need to have another type of job. And I know that you have been like talking about, for example, gender inequality during this week as well. And I think that as a woman, I can not stop pointing this out, but most of the academic positions are also held by men in Chile, at least, and maybe also in other countries in South America. So women actually will need to have a non-academic job, which is sometimes even harder, like to get these two sides together. For example, in my case, I would need to be, like, clinical psychology from one side, and then whenever I have the time, do my research and able to get my degree in cognitive science or neuroscience. So I think that this is not like a picture that is encouraging women actually to get into the academic path, and this will continue enhancing this gender gap that we already have nowadays. But yeah, I mean, we have quite a few challenges and difficulties. Probably I'm missing a lot of them today, but yeah, I think that most of them might be shared with other regions. And I think that these kind of like initiatives like this talk today, this webinar, this week, it's important because we can see the challenges. And if we are able to see, we can maybe try to, generate some programs or strategies that will actually help us to increase possibilities for those who have less possibilities. So that's from my side.
Thank you so much, Aitana, for sharing your experience with us. And I agree with you that the challenges that you've just pointed out are not only there in Chile, they are shared, I'm sure, across different countries and regions. And we will be hearing how, other regions also relate to the same. So our next speaker is Ubada, who is going to be speaking to us from the US, but about his experience in the Middle East. Ubada?
Yes. Hi, thank you also for inviting me. Thank you to ALBA and IBRO for organizing this. So yeah, I'm Ubada. I am from Aleppo, Syria, but I am now a postdoc at the McGovern Institute at MIT. So I'm going to pick up on one of the final points that Aitana made. Yes, actually, a lot of stuff does generalize. I'm going to pick up on the point of educational and research infrastructure. I think, so I'm Syrian. I am talking, when I talk about generally Arab countries and Middle East as it relates to science. And we don't have, there are universities, of course, there is scientific research, there are science programs and degrees, but the kind of research that happens is not something that parallels what happens in the global north or in Western nations. So the specialized training that a person can get has a ceiling if they wanted to then go into careers in other countries or kind of compete with their peers or colleagues for what is conventionally considered to be impactful work. And I'm using conventionally there and, you know, intentionally. So that's one thing. The other thing is something that you, Rachel, pointed out earlier, which is there also isn't, for people who are usually coming from these countries, opportunity is associated with leaving, unfortunately, and going into other countries to get your education. Also, Aitana pointed this out. And when you go into a new place, and you're usually probably the first person in your family to be doing either going to school period or doing science or pursuing academic careers. And that comes with obviously no roadmap for you. And you kind of have to figure that out on your own and learn how to seek out advice and learn how to build a network and a community that supports you throughout your career. And that's work, actually. Like that's work, and a lot of scientists do good efforts to demystify these kinds of things for people. But like there was a study last year in Nature Human Behavior that showed that in the US, a tenure track faculty member is 25 times more likely than the average person in the population of the US to have a parent who has a PhD. And about a quarter of tenure track faculty in the US have a parent who has a PhD. That's a signifier of something. Another thing I wanted to say is, of course, there is a tremendous financial strain for a lot of people coming from the Middle East to Europe or America to study. This was the case for me too. So I worked while I was in college, and I was also on financial aid. And you also oftentimes have family that you need to perhaps send money to back home because you need to support them. Your dollar is like gold over there. And the other thing is visa costs and lots of immigration costs, and maybe you need an immigration lawyer. And these are things that also put a strain on these scholars that are not on their peers, but isn't really accounted for by departments and PIs. And then the other thing, of course, is culture shock, but that's a natural phenomenon of any kind of immigration. But it does take time to orient yourself to a new society and a new structure. So that's something that also when people when you're trying to establish, like let's say you're moving to do a postdoc to let's say whatever, like the UK or to New York or whatever, and you know, there's clocks on things like the metrics for success have usually timelines. And those benchmarks are harder to meet when you need to figure out how do you pay bills in this country? How do you get a driver's, like, you know, like these things take time. And this is a reality also of any immigrant's experience. And then, of course, something that is, I don't know, hard, I don't know how to articulate this, but usually if you're coming from the Middle East, you're back home, wherever you happen to be from, there will be something that has to do with a civil strife or economic struggles or war or famine or something is happening, right? And you have to learn to compartmentalize to push forward in your work. But you'll show up to work and there's colleagues that are either oblivious or careless about what's happening. And it's just a reality of your existence, and you have to figure out how to compartmentalize it and push forward. Building community is very important for this. So I encourage anybody who feels this way to seek out others they can talk to. But I think this also affects the progress of science. and the outcomes. I have a lot of other thoughts I think probably will come up in the discussion about things we can do to help mitigate some of these things and account for some of these challenges, but I think that's all I got.
Wow, thank you so much, Ubada, for sharing. A lot of very important themes that came out of from you there. And one of the things that I wanted to just pick on quickly before we move on to Jacques, who is our next speaker, and while he's sharing his screen, is the issue of first-generation scientists in whatever region they're coming from, whether it's from the developed world or whether it's from the developing world. The fact that you don't have the network and the support that would give you that push to be able to achieve and to be able to succeed. So you're starting everything from scratch, you're figuring it out, and you're a pathfinder, and you're also trying to pull people with you. I think that's something that we're going to sort of like tease a little bit more in the discussion. Jacques, if you're ready, you can
okay.
give it a go.
Yes, thank you, Rachel. Hi, everyone. I'm Jacques Ip. I am currently an assistant professor at the Chinese University of Hong Kong. I'm also a first-generation neuroscientist, and I'm the first one who got a PhD in my family. I don't have like anyone in my family that work in academia, or in any university. My parents are working class. So today I'm sharing from the Asia Pacific perspective. I grew up in Hong Kong, and I did my bachelor in Australia, Sydney, and then my PhD back in Hong Kong, and then I did my postdoc in Boston. And now I'm back to Hong Kong, starting my own lab 3 years ago. So today I'm mainly talking about the situations in the Asia Pacific region. So let me share my screen. So I got this information from the internet. So on the left is the gross expenditure on R&D in the Asia Pacific region by country or region. This is not specifically for neuroscience, just general, but you can see that like the top 3 countries are spending quite a lot, but then the other countries or regions in the list like actually spending not so much. So the message here is that the countries and regions in Asia Pacific, they may not spend like equal amount of money in R&D. And well, this is like the gross expenditure. So but we also need to consider the size of the country and also the workforce of science in that particular country or region. For example, Singapore is relatively well-funded as far as I know, but it's a very small country. It's like a city. So then like the actual funding amount go to each researcher may be higher than other like bigger countries. But the key message here is that the amount of funding varies a lot, like in the region. And the graph on the right is that like talking about the neuroscience market share like across geographical region. So as you can see across like different categories of neuroscience market, you can see that North America is taking from 40 to 60%, like across all like categories. And then Europe is taking like 20 to 30%, and Asia Pacific as a region is taking from 12 to 20%, and the rest of the world is taking 3% to 12%. So in terms of the market share, I would not say Asia Pacific is too bad, having from 10% to 20%, but we also need to see like which countries it comes from. I think we need to consider that as well. So so on the left is my personal experience and perspective. So I think the first message, as shown in the previous slide, the size and amount of grants vary a lot among countries and regions in the Asia Pacific region. And every country and region has their own funding system and rules. So the researchers in that particular country or that particular region had to learn the rules and the game. So and some countries and universities offer fairly limited PhD scholarship. So financial burden can be one major reason for the student to pursue neuroscience degree or not, or PhD or not. So that's the socioeconomic factors. So for me, I think language can be a barrier. So English is my second language. So I didn't learn proper English until quite late in school, I think. So so I often get comments when I speak that I have an accent when I speak English, and or they would say, "Oh, as an Asian, like your English is not too bad." So I would often get comments like that. I think it affects me quite a lot. Affects my confidence when I speak in public, and also when we send out for manuscripts, sometimes we'll get the comment that, "Oh, this is not well written," or got some other issues. So. And they even suggest us to get an English editor to look at the manuscript. So I think, to me, language can be a big thing. That's my major perspective. And okay, then actually the IBRO ECC actually wrote an article and submitted to the journal Neuroscience and discussing the barriers or the challenges faced by early career researchers in different regions. And this is some of the points from the article, particularly to the Asia Pacific region. So I'm just going to go through it quickly. So socioeconomic barriers such as ethnicity, gender, language, financial situation, work-life balance, the early career researchers may have to face. Limited support during parental leave, particularly for female, and bureaucracy in the region can lead to high workload and efficiency. Some journals are skeptical when receiving manuscript submissions from the region, especially from the EC researchers. And a recent survey reported that early career researchers in Asia and Australia are miserable at work due to heavy workloads, bullying, and lack of support, adding to the falling job satisfaction. Lastly, I want to share this one particular example with you. This is actually shared by the other Asia Pacific early career committee member, Dr. Lin Kui Ong. This is a statistic from Australia. So for this particular funding scheme, Stream 1, to conduct early stage, small scale research led by earlier career researchers, only 9 out of 307 applications were awarded. So that's 2.9% success rate, and that's crazy. And 0 out of 23 neuroscience application was awarded. So just to show you like how crazy the number is, like 2.9%, like how can we do something interesting if the funding situation is that bad? Yes, I think that's pretty much what I want to share with you, and I can share with you more during the session.
All right, thank you so much, Jack, for sharing that. That data that you shared is quite sobering. I mean, as part of the rest of the world that is fighting for that 3.4% of research output, I really feel challenged. So I'm going to be representing the African region. And my name is Rachel Dangarambizi. I'm from the University of Cape Town. I am a Zimbabwean, though working in South Africa. So I'll share a little bit about my Zimbabwean experience as well as my South African experience. But more importantly, I am representing the African region. So I'll also speak to other experiences that are outside of my own personal context. I will try to share my screen, and you are forewarned that I might not do that as well as the others have done, but please do confirm to me if it is working. Tracy? Has that come up?
Great.
All right, perfect. So I decided that maybe perhaps I should start by looking at the context of the historical context from where we're coming from as the African region. and how that affects where we are today and how that should inform how we're going to go into the future. So this is common knowledge, and it's sometimes frowned upon to go back to history because history is painful, but it can be quite empowering as well for us to really know how to move forward. So the history of Africa has got a colonial past, but that past was associated with segregative educational policies that were intentional, so to speak. So there are examples of certain acts or policies like this Bantu Educational Act in South Africa, which were implemented to ensure that certain people within the community would have only certain jobs and could not get certain levels of education. The Bantu Educational Act, for example, said that all Black people should be laborers, but should not get science or tertiary education, et cetera, and related kind of qualifications. They belong in the fields, they belong in the kitchens, etc. Now, coming out of a past like that, when we gained independence, and I say this with all respect to African governments that took over from the colonial masters, but I feel that there was no intentional restructuring of curricula to ensure that we take away this discriminative aspect. So we have curricula that are still there that are not really very useful for people, and they are restricting and they limit people from getting through to tertiary education or even into science. Now, the question maybe that we should ask ourselves is, how does that affect the current state of education? Because it is in those schools or high schools that we get the next scientists or neuroscientists. So already you're starting off with a very tight funnel system that limits the number of people that can get access to science or can get access to neuroscience. There is continued inequality as a result of the previous, segregative policies that were there, both economic or social or cultural. So, for example, it was not uncommon to have signs like this one, where this would be a school or a public place where Blacks are not allowed, and it's only supposed to be white. But this has not really been, addressed adequately. So we still have regions that have got, predominantly certain demographics and other regions that do not. And if you look at them, you can actually see the difference, in the socioeconomic status, and that determines who gets to university or who doesn't. That determines who has access to science and who doesn't. And if you want to stretch it a little bit further, it also even determines what kind of role models people in different settings get. Because if my grandmother was just supposed to be working in the kitchen, she is the person I see and the person that I would like to be like. I have no knowledge of what a scientist or a neuroscientist does, or a doctor, because I've no experience with them. And it also determines the amount of support that one can get. All right, I'll move on. Now, the current socioeconomic status in Africa is another thing as well. We've looked at the historical, but what do things look like now? And this is also common knowledge, but more than a third of the African population lives in extreme poverty. So that means less than $1 per day. And already, if you look at that, that means that there's a lot of challenges in terms of access to education or quality education, especially because in Africa, basic education all the way through to tertiary education is paid for off pocket. So if you're comparing a university graduate or a university student in Africa, they have to be thinking about, where do I get the fees? Where do I get the food? Where do I get all of those things, in addition to worrying about their studies? Whereas I've been to certain places, so for example, Germany, where university students have got free access to education, they've got free access or subsidized access to transportation, et cetera, they're fully supported by their environment. So the question that I ask myself when I look at this socioeconomic context within which people are coming from is, what are the chances that these children will end up in neuroscience? And I brought a picture here that is almost on a personal level a little bit so, because I started my education in a setting like this, where there are no proper structures, no proper classrooms. You know, when we're talking about low resource settings, this was the lowest of resource settings. And we would go to school with no shoes on our feet. It's not, you know, it wasn't even anything we worried about, because we just thought that's what it was. And no proper uniforms. Most of the children would come to school without having eaten any meal. And, you know, in a setting like this, if it starts to rain, then the class is over, et cetera, et cetera. So this is where I come from. And I know one may say, well, you then made it, now you're a neuroscientist, so it means there's a chance. But the truth is, I am one out of more than, I don't know, hundreds of thousands of children that had potential, probably better than I did, to be able to come to science, but never got to do that because the environment was just restricting. And in addition to that, we also have a huge brain drain. Because, you know, employability and everything is very, very low here. There are high levels of unemployment. As soon as people graduate, the few that will have gotten through, the next thing they do is to look towards greener pastures, and they leave. And that already also creates a gap, because we don't have the continual capacity building. You know, we train people, but we're always lacking the number of people that can train the next generation. So sometimes research in Africa feels like you're trying to fill a bucket, but it's leaking at the bottom and you can't really see your efforts. And then I would like to end off on the slide by just talking about the general, you know, context around research itself. In 2006, African governments got together and decided that they were going to put 1% of their GDP towards research, but the reality is far, far, far from that. You know, now it's 2023, and the best we've got, which is South Africa, has got a GDP allocation of 0.77% going towards research. So there is very little government funding for health and research. There are limited opportunities for employment. I've said this already. And research costs as well are some of the things that we don't think about. We are not producers, we are consumers. You know, our industry is not as developed. So you'll find that most of the research consumables that we want to use for our research have got to be shipped from the US or bought from the UK or some such. And so we end up paying double or even triple for the same kind of resources. And even where, you know, we've got companies producing, there's a lot of monopoly, there's a lot of bureaucracy. And it makes it even harder for researchers to, you know, to thrive and to survive. But I would like to end off on a good note. There are many untapped opportunities for growth, and I'm hoping that we can open up the discussion and get to those. But thank you. That is my sharing from the African perspective. Right.
Thank you, Rachel.
Thank you. So moving forward, I will hand over to Jack, who will introduce the stakeholders, and they will be speaking to us next.
Thanks, Rachel. So next we have Gail Rodney from the Elsevier. She'll share with us the perspective from publishers. Thank you, Gail.
Thank you. Let me share my screen. Is it in presenter mode? Can you see my screen? Okay,
yes,
great.
Yes.
Wow. Thank you for sharing your stories. And thank you, ALBA and IBRO, for allowing me to participate in this important discussion. As we've just heard, inequities in academic research manifest in many ways. And as citizens of the research community, we publishers must ask ourselves a couple of questions. How do we advocate for these underrepresented groups, and what do we see as our role? In that vein, I thought it would be best to lead with a quote from our CEO, And the quote is, "I strongly believe in the mission and the purpose of Elsevier and the impact we have on societal good." I think it's an amazing quote. These are simple but powerful words that resonate with every one of us here at Elsevier. It then begs the question of what is our mission? And the Elsevier mission is to help researchers and healthcare professionals advance science and improve the outcomes for the benefit of society. Not some members of, but every member of, right? We know that there are a low proportion of female tenured professors, as mentioned as one of our speakers. We know that there are low rates of grants awarded to women and researchers of underrepresented racial and ethnic groups. We know that there's challenges with access to high quality peer-reviewed content for some. We know that there's insufficient diversity and inclusion on many editorial boards. And we know that science is communicated in English, but not everyone communicates well in English as it's not their native language. That's why these conversations are so important. And that's why we've been committed to supporting the community for 140 years. We publish 2,800 peer-reviewed journals. We are publisher agnostic. If you need to publish in an open access journal, we got you covered. If you need to publish in a gold open access journal, we got you covered. Even though we are publisher agnostic, I know that there's a lot of talk around gold open access journals. So I thought it would be best if I took you through a really quick journey of our open access journey here at Elsevier. And it begins in 2002. About 21 years ago with Research for Life. I'm not going to go through all this in the interest of time, but I think this is important. So Research for Life, it's a platform. It provides free to low cost online access to LMICs, which are low to middle income countries. There are 151,000 journals and books on that platform, and Elsevier contributes about 20% of the peer-reviewed content on that platform. And I will say this, both IBRO journals are on that platform as well. Elsevier is a founding member of Research for Life. We jumped to 2004, that's our self-archiving policy. So even if you publish in a hybrid journal, you may upload your author-accepted manuscript to your personal website, also your institutional repository for internal use. Also, some platforms such as Archive and Repack. I also add here that Elsevier has a preprint server, SSRN. We have share links in 2014, and what that is authors who are accepted receive a customized link that you can share externally, and with that it provides 50 days gratis access to anyone who clicks on that link, so it's good for sharing on social media or sharing via email. 2018, that's your transformative agreements, that's a publish and read. And so I'm going to jump to 2023. So we have 700 fully open access journals. And I know the question you're thinking right now, that's great, you have fully open access journals, but how can I publish in these journals if I don't have the funds? And it's a very good question. And while this is not an exact comparison, I will liken the APC to the sticker price in the car, right? So in the US, when we go to buy a vehicle, there's a sticker price. There's a sticker on the car with the price. Nobody expects to pay that price because you understand that there may be discounts available. So again, not exact comparison, but if you are a member of Research for Life, so if you access content through Research for Life, you are automatically, you don't have to ask for this, automatically given a percentage discount or a waiver. Now you might be asking, well, what if I still don't qualify under the Research for Life? And that's okay too, because you can also write to us and ask if you can demonstrate need, and you can ask for a waiver or discount. You just email support@elsevier.com. I want to also highlight something new that we just rolled out, geographical pricing pilot. And it's an industry first model. And this offers discounts and waivers based on local economic conditions and average income. So let me give you an example. If I were an author in India and I wanted to publish in a gold open access journal, I would not qualify for a discount or waiver based on Research for Life. With this geographical pricing pilot, I would be eligible for an 80% discount. So we recognize that there were there are gaps, and we're addressing the need. Now, it is a pilot. Not every journal is included in the pilot, and we'll be transparent about the results when we have more data, but it's a good example of how we constantly reevaluate our services to meet the need of the under-resourced community. We talked a little bit about access to content. We talked about being publisher agnostic and waiving and discounting of APCs, but our efforts need to go further, right? It's not only about access, it's also about having a seat at the table. It's about policy making and leadership. It's about ensuring greater inclusion and diversity within the academic research ecosystem. So these are a couple of points I've listed here that we're doing with our focus on inclusion and diversity. So in 2020, we established an Elsevier Independent Inclusion and Diversity Advisory Board. Why is it independent? To be an effective advocate, we believe all need to have a voice. We just can't be us speaking to us, right, about things that affect the broader research community. We need input from all, and we need input from people, from those who are most affected. Then we have the implementation of self-reported diversity data and editorial manager. Why do we do this, right? So editorial manager is where our submission manuscript, our submission platform, and also where our editors and reviewers work. So why do we do this? Because we want to hold ourselves accountable, right? Are we meeting our diversity and inclusion standards? Are we truly representative of the field in the community we serve? This is a reality check. We also have an early career research program. And why? Why? We do this to help with career progression. Again, the power, we believe, is in leadership and policy making. We want to help with your visibility. We want to give you the tools so that you can take up all the space you need in a room at any time. And finally, I want to leave you with some resources and further reading. I'm not going to go through all these, but I just want to highlight two. I want to highlight the Elsevier Foundation and Research Academy. So the Elsevier Foundation is funded by Elsevier. The foundation contributes over $1 million a year to nonprofit organizations to advance diversity in research in developing countries. Research Academy is a platform with e-learning modules that provide career and guidance advice. So I will leave it here and hand it back to the host, but I thank you so much for your time and attention.
Thank you, Gail. It's good to know the perspective from the publisher. And next, we'll have Mrs. Sam Palmer. She will be sharing from the perspective as a funder. She is from the Medical Research Council, UK Research and Innovation.
Just give me 2 seconds to get my slides up and I will be with you. I seem to have lost them. So while I am getting my slides up, obviously I am based in the UK. A lot of what I'm going to say is quite UK centric. However, I do believe that there are other areas that we can influence overseas. And sorry, I seem to have lost my slides. Bear with me. Oh dear. They were there. Sorry, this is quite embarrassing. Oh, here we go. Can you see them?
Yes, but it's now not in presenter mode. Maybe
that's fine. I'll do that now. Yeah. Okay. Okay. Is that okay now? Excellent.
Yes.
Okay. So the Medical Research Council is a UK funded council, and we come under the umbrella of the UK Research Innovation. So the Medical Research Council is in its name. Our mission is to improve human health and to fund world-class medical research. We believe that equality, diversity and inclusion is a key priority within the Medical Research Council. And what we do as a council is both internally and when we fund our researchers is that we ensure that equality, diversity and inclusion is included in the research that they do. that we provide due diligence processes to ensure that their universities are adhering to specific policies and practices. We also do visits to universities to discuss on how policies and practices can be improved. Within the UK at the moment, with the Medical Research Council and UKRI, we are really only just looking at the socioeconomic and social-cultural differences within funding. One of those things that we are doing is looking at place agendas. So where is our funding going to? Who is it going to? Why are we only looking particularly at the southeast of the UK, which is where London? And how can we redistribute funding across the whole of the UK? So this is some piece of work that we're going to be doing over the next couple of years. And part of that is looking at the resource that is in these institutions, the funding that they receive, the science that they're doing, where are the gaps that we have within the portfolio. So for example, could be neuroscience in a particular area of the country that is low on funding, and how we can help with funding, with equipment, with in-kind contributions to particular universities to help them increase exposure, publications, and additional funding. We are also within our calls, we're very particular in regards to gender equality. So within our international
Sam, I'm so sorry to interrupt you, but your sound is pretty bad. So maybe you could turn off your camera and see if this improves.
Of course.
Bad internet connection.
Okay, is that better?
That's much better.
Yes.
Sorry
Excellent.
that we don't see you anymore, but we can hear you fine.
Never mind. So our Professor Dame Ottoline Liza is extremely keen on equality, diversity and inclusion within UKRI and also across the country and across the world. When we fund proposals, and sorry, excuse me, somebody started to play an instrument outside. When we fund proposals, one of the things that we expect our applicants to do is to provide a document on gender equality, on capacity strengthening, so where they're going to be doing the research, why they're doing it in those areas, and how, once they finish that research, they can increase capacity within those settings. This is peer reviewed by external reviewers and also by a standing board and panel. So at every part of the process, we're very keen on ensuring that the right people get the right amount of funding to do the right research. And that is it. Thank you very much, and apologies for the noise.
Thank you. Thank you, Sam, for your sharing. Next, we'll have Tracy Bell, the current president of ALBA, to share from the perspective of the organization. Tracy, please.
So I think, Sam, you need to stop sharing. There we go. Thanks so much, Jack. I'm super excited that we're part of this webinar, even though it's the crack of dawn here in the state of Colorado in the US. I'm excited to see we have quite a number of participants on the webinar. And I'm hoping, I can't see where everybody's from, but I'm hoping it's a good representation from around the world. As you know, we just had the ALBA World Congress recently in Granada, Spain, which was an incredible opportunity to engage globally. I'm going to share some slides, but I just want to kick off by saying that ALBA Network has really filled a gap in neuroscience and in science in general to find ways not just to connect and mentor, but to really establish a way for advocacy and forums around the world. ALBA has been hosting many different types of webinars and many events, as many of you may know if you've attended a neuroscience conference in the last several years, which I really applaud, that it is such an important thing. I think there was a comment actually in the Q&A as to how might we actually have actionable items, where might we apply pressure to start to make some change? You've heard some incredible stories from our individuals on the panel today of barriers that are seemingly huge and insurmountable and continuous. I have to say that as an American, some of the directions this country is going as it relates to DEI are frustrating and quite embarrassing, I have to really say. And I think that we all have to work together to continue pushing to ensure that those individuals that hold such biases and discriminatory practices have to be held accountable. And I think that's the thing that we can do together. And as a senior faculty member and president of IBRO, I feel very much that that's a responsibility that we have. So I do have a few slides to share about IBRO for those who may not be completely aware about what IBRO is or opportunities from IBRO. And I do think that one of the greatest hurdles that we work with at IBRO is communication and just getting the word out about these opportunities. And that's a huge part when we say DEI. You know, we all understand the diversity part. We also understand the inclusion part, but it's the equity piece that sometimes is the hardest aspect to focus on. And that equity piece means you may have resources and opportunities, but if individuals can't access them or don't know about them, it's really not equitable. And so on this first slide here, as put together by our incredible staff and secretariat at IBRO. So IBRO, first of all, is the International Brain Research Organization. As Jacques introduced, I'm the president. I'm in my second term. A term of presidency is 3 years. The organization is about 63 years old. It is the oldest neuroscience organization in the world. And I am the first female president, as that might be one barrier that we can think about overcoming as in terms of inclusivity. The first term of my presidency, we worked very hard to increase our transparency and make all resources equitable and easily accessed and easily understood, because it is human nature, quite honestly, that if you don't understand how decisions are made, to tend to think that there is a bias in how those decisions are being made or where the access is. And so we want to make sure that all processes are as easily accessible and understandable as possible. We receive constant feedback and always welcome feedback for, I don't understand how this decision was made. I don't understand how to gain access to this resource. So that's something that's very important to us. The organization of IBRO is divided into 5 regions. So we really represent the entire world of neuroscience, which is pretty exciting. Each individual neuroscientist is a member of IBRO, but you do not pay, as was said earlier in the webinar. I think Rachel pointed out that, so really your membership is at the local level. We really advocate for individuals to become members of and engage in your local neuroscience organizations and societies, whatever that means for your local region. But it's those member societies that they themselves are the members of IBRO. So we really represent well over 90,000 neuroscientists from around the world. So as you can see on the map here, the 5 regions include the US, Canada, Latin America, Africa, the Pan-European Regional Committee, and the Asian Pacific Regional Committee. These are historic. These are not regions that we divided, but rather when the organization first began is how they were divided. There's lots of reasons which we don't have time to get into today as to why they are divided in such a way. We have worked very hard in the last several years to make it very clear that our entire budget, and so the way that IBRO generates revenue is through, as Gail pointed out, our 2 Elsevier journals. So IBRO owns the journals, but our publisher is Elsevier. All of the revenue that goes into publishing in neuroscience and IBRO neuroscience reports generates revenue that comes back through our agreement with Elsevier. And all of that money goes back out into the world to community build, for career development, for outreach and engagement, and of course, for dissemination of research and training. And so all of that money is divided equally across all of our 5 regions. There is no longer a system whereby the regions don't know what money they're going to have or why one region gets more. We completely transformed that in the last 3 years. We have a set amount of money. It all goes back out into those 5 regions. And what's really important towards equity and inclusion and diversity of neuroscience globally is that it is not a top-down organization. It is really a bottom-up. And that means within each of these 5 regions, there is a regional committee. And as Rachel pointed out, she is a member of our African Regional Committee. And so each regional committee determines what is the need in that region. So it is not IBRO leadership saying, hey, we think Africa should do X, Y, or Z. It is quite the opposite. It is in fact African Regional Committee that determines what they want their money to go toward, what they think their regional needs are. And that is how the budgets are then developed, bottom up, not top down. There are other parts of IBRO that work very hard to try and encourage interactions between these 5 regions, because really there's no need to be isolated. We all do better when we work together. And so there's a lot of initiatives that are in the works through the last several years of trying to promote these relationships. It really does begin with our regional committees. So we have, for instance, our Latin American Regional Committee that is working with our African Regional Committee to develop different types of partnerships and programs, et cetera. And this also occurs between many of our regional committees and the US, Canada, or Europe, et cetera. And that is a way, whether it's putting together a white paper that can be published in one of our journals, it is a way of increasing travel opportunities. I mean, as has been highlighted, it's very difficult in many countries around the world to gain access to resources and training. We really want to discourage the brain drain that was mentioned earlier by Rachel. And instead, we have opportunities, and I think I might have, yes, here we are. So these are by far and away not all inclusive of the opportunities within IBRO. Go to the IBRO website. You can see all of the opportunities. There's deadlines to apply for different opportunities. Every year we have a grant deadline. We have a budget deadline that the regional committees work with, et cetera. So you can learn all about that on our website. If you have any questions, the Secretariat is always willing and happy to answer those. But with relation to the brain drain question, is that we've tried very hard to develop opportunities to do partnerships and training and collaborations, but to have individuals then have, for instance, we used to have a program called the Return Home Fellowship, which is now called a Rising Star, but it's an opportunity to have funding once you've gone abroad for training, say your PhD or your postdoc, to have funding to return home and start a lab. There's many, many examples. There is a couple actually from Iran that received funding from IBRO to train in Germany with Inga Neumann, and then received a Return Home Fellowship, and they were able to utilize that funding and capitalize on that to have equipment and to return home to Iran and be very successful in starting up a lab and train individuals within Iran. And there's many, many, many examples such as that of individuals. And I will just tell you a quick story of meeting this couple at the IBRO World Congress in Granada recently, and who wanted to ensure that they told me as the president that IBRO had changed their lives. And I think that, to me, is incredibly impactful, to think that making sure that the funding, again, it's limited funding. We don't have infinite amounts of money, but we do everything we can to make sure it's as equitable as possible and impactful as possible, so that every euro or dollar goes and influences and impacts as many individuals as possible. And that happens through opportunities to travel to conferences and schools that are held around the world, diversity grants. I think to Rachel's really great story about opportunities within Africa, for young children of who are attending school outdoors and don't have resources, that there are opportunities that I'm seeing pop up where there's different access to brain camps and brain schools and brain awareness week, et cetera, that are happening that give children around the world really inspiration toward knowing what opportunities are out there. And I think to Rachel's point, how can you know something is an opportunity if you don't even know it exists? There are many hurdles, as you've heard, that stem from everything from unstable governments, wars, famine, that are quite stressful right now. We have a mental health crisis for many reasons, including the pandemic that placed such pressure on everyone. So I think as a community, and president of IBRO, I feel incredibly responsible for ensuring that we take every single opportunity we have, every dollar and euro that we have, and try to make it as impactful as possible. And I applaud ALBA for trying to bring individuals together, for individuals that have resources to individuals who need those resources, the mentorship, which is critical as well. So I'm going to just one last plea and prompt for the fact that if you have opportunities to publish, here's our 2 IBRO journals. These journals are published by Elsevier, and through our contracts with Elsevier, it is those that publication in these journals that brings in the revenue that we can then put back out into the community. So thank you for publishing in our journals. It's always appreciated. And I'm happy to help take any questions that we can and answer anything I can about IBRO.
Awesome. Thank you so much, Tracy, for sharing with us about the activities of IBRO. So now we're going into a question and answer session or a panel discussion, and I'm glad that Sam is back on. We've got questions from the audience, but we also have some questions that we've got here, and I'm going to start off with Sam because she may have to dash off. So Sam, the question that I have for you is regarding receiving diverse, applications from different regions and how you can objectively rate them, given the different contexts from which they're coming from. So, you run global funding programs, you receive applications, they are from diverse regions. How easy is it to compare an application from Japan versus an application from Malawi? Would you like to speak to that, Sam?
Yes, that is a very good question. When we look at applications, to be fair, the main element is the science. Is the science that these people are doing relevant to the countries and regions that they're in? Is it high quality? Is the application high quality? Have they articulated why the methodology, the pathways to impact clearly? Is the budget value for money? So when we ask our reviewers to look at applications, it is more about that than it is about the fact that they come from Japan or Russia or Malawi. It is predominantly about the science. When we go to look at the applications for funding, we are acutely aware that within the international sphere, we need to be to not be biased. We need to ensure that we look at everything that's in front of us and to make sure that everybody gets an opportunity for funding based on, unfortunately, a very limited budget.
Thank you so much, Sam. Yeah,
my pleasure.
No, you can go ahead. Sorry, didn't mean to cut you off.
No, it's fine. It's just what I wanted to say was, don't feel that you cannot apply. It's a competitive market. We get around about 300 applications each time a call is run, but we encourage our lower to middle income country participants to apply directly because they can. They do not have to have a UK lead investigator. They can apply directly to us. And if you're not sure, to ask them or yourselves the question of eligibility, and is my research within remit of that particular call. So we're always open to listen and provide feedback. Thank you, Rachel.
All right, thank you, Sam. I'm just going to give you maybe a minute in case you want to say anything else, or if there's anything else you wanted to emphasize in case you have to drop off. No other additional. Thank you so much, Sam. Thank you for joining us. And yeah, I will see you a little bit later when I rejoin the rest of the group. Thank you.
Thank you, Rachel.
Right, our next question is going to be taken by Jacques. Jacques, do you have a question for one of our panelists?
Yes, I have a question for Tana. So she shared the difficulties from her country to Germany. So we're interested to know more about how she ended up studying psychology at uni, and how did she get into the opportunity to do her PhD in Germany. So maybe her experience can help the next generation to get opportunities like the ones you're getting right now.
Yeah, sure. I actually think that I was very lucky because I had the opportunity to work with a very great group of scientists. They were all about this open door policy. So if you're interested in doing research, even if you're an undergraduate, you are free to come in and ask. And basically, considering their own history, the academic path and everything, they are guiding new students in order to help them to get research funding or even scholarships, to get new positions, to try to, try to go to Europe or even the USA to study abroad, because we don't have that many programs in cognitive science or neuroscience in Chile.
So did you get a connection to get to Germany, or you just send cold emails and apply everywhere? So how did you do that? So
yeah, I think that it was a little bit of both, actually. We received also a student from the same university that I'm in now. And I also contacted the professor. So basically it was a both-way connection. And
I see. So it seems that setting up connections and also sending out many emails can help. So do you have any advice for young researchers to see how to tap into the opportunities or getting a PhD or get interns at labs?
Yeah, I would say to try, if it is what you really want, to keep trying and do not get discouraged if sometimes they don't work out at the first time. We get no emails as well, so yeah. And yeah, making connections and with your former PIs or with other professors. And I think that is also a very good part of if you're in a region that is not that well connected or that well developed, for example, in the field as we are, having these collaborations, international collaborations, might help also to put everything or more people in the picture. So that's also very helpful.
I see. Thank you. And I guess the same question can actually goes to Ubada. Currently, you're now in a very nice institute working in neuroscience. So what advice, how did you end up going to McGovern, and what advice would you give to the next generation?
I can describe my path, but I don't think it could be used as a rubric or as a blueprint, because it was so serendipitous. I didn't even grow up wanting to be a scientist. I didn't see it as a career that was, I didn't even know it as a career, and I didn't see it as a career for me when I knew it as a career. But in undergrad, so when I came to America, I did 3 years of community college. And then I did transfer to a university, and I did 2 years there. And in my undergrad, somebody had told me, all my friends were pre-med people and I wasn't, and they were like, oh, you should do research because it helps you look for opportunities when you graduate. So then I emailed this professor on campus And I was not at a school that's great or known for science. But anyway, you look for opportunities wherever you are. So I emailed this professor, he didn't respond. And I kept following up for 4 months for a semester. And because he was the only one working in the field that I could do anything in. And then eventually I just went to his office, and then I was like, hey, I'm Mubada. I'm the guy who's been emailing you all semester. I was like, oh, sorry, I couldn't get to your email. Yeah, when can you start? You know? So like, I just went to his office. I worked with him for a summer, and he was like, hey, you should think about doing a PhD. You seem to enjoy this. And I said, I don't have money, and I don't know how to write. Oh, I don't like to write, is what I said. And because I thought that PhDs were rich people who write books. That's my understanding of it at the time. And because I didn't know anything. I didn't know anybody in grad school who's
It's not totally wrong, Abuda. That's not totally wrong.
But you don't have to write books, guys. And you don't have to be rich either. So he explained to me, like, no, you can get a stipend and you can do research and get paid, modest, but you can still like get paid something. And so I applied to PhDs programs, got zero interviews. Because I also didn't know how to apply. I didn't know how you're supposed to write a research statement. I didn't know that I can even ask this professor for help, and now I know, and now I tell people, whatever. But like at the time, you don't know what you don't know. So then I worked for a year, and then I applied again with some more intention and research. I got into one program, Virginia Tech. I did my PhD there. Even the field, like I applied to PhD programs in different fields that were interesting to me, not just neuroscience. I was interested in synthetic biology. I was interested in virology. I was interested in lots of things. I applied to lots of things. And then in the PhD program, I focused on neuroscience. Initially, I wanted to put humans in an fMRI and make them do things and study them. And then I realized that, no, actually, something more compelling to me was the molecular neuroscience. And so, but that was mainly because of the PI, because I found somebody that I knew I would be in a good culture where I can thrive and I can get interested in any science. So then I did that. And then I finished my PhD. And when it came time for the postdoc, or deciding to do a postdoc, I decided I want to give it a go. And was very careful who I emailed. By the way, I have a whole guide if people want to think about how to approach a postdoc on my website that's free and has resources. But yeah, I mean, I emailed 3 PIs, ended up one of them that I liked was here, and that's why I'm here. But advice would be persevere. Like what I did was not I didn't backwards plan. I didn't have an end goal and backwards plan from it, how I'm going to do every step. I just chased opportunity. Where Boston is the first time I choose where to live in my life, So like I just go where I can. But there'd be a lot of times where people don't respond to you, like Aitana said. But sometimes you just need one person to take a chance on you. And also be more active about Googling and searching for opportunities. Don't hesitate to ask people for help. Right. Most people will help you. Most people are generous with their time.
See, thanks, Uber. That's really great advice.
Jacques, can I add to that excellent really points? Is that I think it's really important to also appreciate that on this end of the email, I get hundreds and hundreds of emails every day. Yeah. And if you send me an email and as I'm scrolling, if it scrolls off my screen and sometimes it's not personal, but it's just a lot of stuff and it's just really easy sometimes to forget. And so I think the emails that I'm most likely to immediately respond to are when they seem specific to an intentional question and not a cut and paste that you sent to 500 PIs, because I'm going to ignore that. If you didn't take the time and you're not specifically looking because you have experience in the area that's relevant to my research and you took the time to look at what my research is, right? That's going to be a closer engagement than if you just copy pasted something that's very general and generic. I mean, I get emails that are like about plant genetics and I mean, just stuff that's clearly not. It's not that don't think that you're an important individual. It's that I just don't have the time. And if you didn't take the time to make it specific, so take the time. Yeah. Check for grammatical errors, have someone look it over for you. If you really are specifically looking at a lab or have a really specific question you want someone to help with, it's really worth it taking the time to craft that email to get it, more likely get a response from someone who's really busy. Not because they don't care about you, but just because it's really hard to answer all of those emails.
Yes. Thank you, Tracy. Thank you for sharing the advice. Rachel, I will let you to have the next questions.
All right, thank you, Jack. And Tracy, while you still have the mic warm, I would like to sort of like follow up on the question that we had asked Sam and bring a little bit of context to it. I know that IBRO also funds research and research-related activities, but the question really was, or maybe the context is that, you know, institutions that don't have enough resources are not likely to support, you know, their, what can I say? Maybe students coming from there, as well as institutions that are established. The amount of support you get from Oxford is probably going to be different from the amount of support you get from a university somewhere in Zimbabwe, where I come from, for example. So it sometimes happens that, you know, funding goes to the same people every time because they've got the structure set. How do we as funders, you know, break that? How do we support the student who's not well supported? Their recommendation letter is not as, you know, as shiny as the one coming from Cambridge, but we would like to support them because they've got a good scientific idea. How does IBRO approach this?
Well, that's a great question, Rachel, and something that we at IBRO are very aware of. And so our DEI metrics that we put in place 2 years ago in my presidency of ensuring that this is the case, right? Because we don't, for our funds, for IBRO funds to be as impactful as possible, giving them to those same labs that always have the resources already, know very well how to write grant proposals, have lots of experience. That's not equity. And so it starts at the regional committees, because again, it's bottom up. So Rachel, you as a member of the African Regional Committee, you are in a place to ensure that all of the school applications that come in for your budget approval, all of the travel awards, that these individuals are exactly those individuals that don't necessarily have those kinds of resources, that they are getting. It's a disbursement of opportunity. We have at the level of our secretariat within our programs, our director of programs, Becky Hadid, ensures through her metrics that, again, these individuals, it's not always the same people getting all of the, right, they apply for everything and therefore are getting the, right. So we try to make sure that there's a distribution at that level as well. And I think through trying to build partnerships across our regions through our regional committees also helps to apply better equity for access to traveling abroad or traveling to a conference, et cetera, that it's not always going to those labs very much. Even within the US-Canada Regional Committee, their focus within that region is on, within the DEI metric and lens, that they're ensuring individuals coming from under-resourced areas and regions and individuals, underrepresented groups, not just, again, applying those funds to labs that have plenty of money. That would be pointless. So it is something that we do very actively within IBRO.
All right. Thank you, Tracy. And before you get to go, you know, what I hear you say is that a blanket approach doesn't quite work. You have to, I mean, you look at equity rather than equality. So I'm going to kind of follow up with a question on equity versus equality. How do you support different regions? I mean, do you give them the same amount of support? And is that enough? Or would you be, you know, as IBRO, willing to give more resources towards a certain region with more need in a way for those resources versus another? What is the approach as IBRO?
Ooh, that's a really, really big question. So within our budget, we have determined that the best way to distribute the general IBRO budget across the 5 regions is just to cut it, divide it 20% goes to each of the 5 regions.
Right.
But what we've tried to do within each region is to help the regional committees, as you know, being on the regional committee, Rachel, to help with when there's new ideas that come up, to try and help how we might build that either, again, between the regions to work together, or to help each program be as impactful as possible, and to help say, okay, so if you want to build that into your budget, let's think about how we can work that in for next year's budget, et cetera. Unfortunately, you know, we don't have infinite resources. And so it's really about working together to see how we can be as impactful as possible. And a big word for IBRO that I've worked very hard on is accountability as well, that we ensure that we're doing everything that we can on our end to make every one of those euro or dollars count toward where they can be impactful. And I think about that from everything from, you know, so my position is volunteer. I don't have any honorarium or any funding that I get. But when I do have to travel for IBRO, I personally think about, okay, if I'm spending on a plane ticket or whatever activity, how many travel awards would that have gone to? And how can, even at my level, how can, you know, so that I think we do as leadership think about every single euro that can go out into the community and be impactful as possible. And that as we're growing our early career committee and working with ALBA and the World Women of Neuroscience, how can we all, rather than reinventing the wheel, how do we work together again to ensure that at the earliest career stages, we can be as helpful and keep that mentorship going throughout the career stage.
Thank you so much, Tracy. I would have loved to chat a lot more about, you know, more questions, but we're running out of time. And I would like to ask Gail to bring a voice onto the panel from a publisher's perspective. Gail, the question I have for you here is regarding open access. You knew I was going to ask about this. This is the most topical thing at the moment. So the question says, open access publishing looks very promising in terms of offering equitable access and impact. But there's also a concern that it may perpetuate inequality. So can you, in a nutshell, explain how open access publishing will benefit researchers in low to middle income countries? Like, I will come back to Zimbabwe again, or South Africa, wherever I am. I'm comfortable to just name that. But yeah, how will a Zimbabwean researcher benefit from open access? Are they not more, okay, you go.
Are they not more, sorry, what is the question? Are they not more
are they not more prejudiced from, you know, from publishing or from access to publishing by open access than by, yeah.
I understand the question. Thank you so much. It's a good question. So we are working with editors to ensure that we address implicit bias, right? That's why we have these systems where people record, self-identify, right? So we look at our reviewer pool. Are we really as inclusive as diverse as we are in our reviewer pool, our author pool, and our editorial boards? We're also being more intentional with our editor appointments to ensure that we are being more inclusive and diverse on the journal, because we want underrepresented researchers to help shape the future direction of science. It's important for us. I mean, these are very small steps, but we're always reevaluating our actions to ensure that we're trying to meet the needs of these communities. Does that address your question?
Yes, it does. Thank you so much, Gail. I'm being reminded over and over again that I'm completely out of time, but I've been given one last question to ask, and this is an open question. Anyone can take it. But the question says, should we be rethinking or reimagining our definition of scientific novelty or relevance or significance or impact in whatever different setting we are? Where is it currently centered? What is our definition of impact and relevance and novelty? And, you know, does it apply across all regions? How are we approaching it? So anyone can take this one, and then we conclude and close. I know it's a hard one. That's why I left it last.
Well, I will just say from Elsevier perspective, we believe in good science, right? Any paper reporting scientifically accurate and valuable research is good science, right? And that's the way we approach it many of our journals, most of our journals. And so, yes, short answer.
All right, thank you. Tracy, do you want to add anything?
Yeah, agreed. I think it's just really important to, all of the hurdles that exist and how serious that they are. And that as a community, it's focusing together to elevate, a rising tide raises all boats. And I really think that is going to be our best way forward. And I know there's been a lot of messages in the chat about it seems abysmal and it seems difficult and how will we do this and who do we hold accountable? And, certainly none of us are going to be upholding our federal governments accountable. And Lord knows in the US, I can't even imagine where to begin. But together, we have incredible power. And I think there's ways. Social media is one way to advocate for each other. Voices have incredible power. Work at your local grassroots level. It's amazing. You can have such impacted policies, even locally, that do have a way of working their way up, and support each other. Advocate for people. When someone does something good, it doesn't make you look bad. So support them. Yeah. And so, and advocate for each other and applaud each other. And it really does make a difference because it just shapes how we feel about science when we're in a supportive environment.
Thank you so much, Tracy. Ubada, 1 minute, and then we close.
1 minute. Okay. I just want to say that, yes, to both Gail and what Tracy said. And I wanted to say that science, the scientific enterprise is a social and political enterprise inherently. The scientific method is, yes, okay, unbiased, and but like we're people, we're human beings. And so like when you're reviewing papers, even if the mission of the journal is XYZ thing, the reviewers are people. And so like there has to be active training and guidelines for reviewers. Same thing with grant review. Same thing with if you're organizing, like to Tracy's point, we all have some kind of power and some kind of leverage, some levers to pull on. If you're organizing a conference, maybe try inviting somebody that isn't necessarily a leader in your field, but is your colleague in your field from another continent or another country that wouldn't otherwise have access, and create a funding mechanism to bring them over to your destination expensive $7,000 conference. Like it's very, I go to Gordon conference. I mean, one nice thing about being in these institutions and this gig is like, yeah, you get to travel and go to nice things, but everybody there is the same familiar faces, and it's two different ecosystems, right? And we have power as individuals, as scientists, to build bridges and share some of this like resources on our side, including exposure and collaborate, which will lead to collaboration, which will lead to grants, which will lead to co-authored paper, like things like that. So there's many ways that we can contribute on an individual level. We don't have to wait to overhaul entire institutions to do that.
Right. Thank you so much, Ubada. Unfortunately, we've really run out of time now. I cannot even give anyone else a minute. I don't know, Francesca, I know I had seen your hand earlier on. Do you want to say something before we close? Okay, she's coming up.
Hi, can you hear me?
Yes, we can hear you.
Hi,
You've got
hello.
1 minute.
I just want to say hi. This is great. I think I just want to say one thing. Something that Ubada said, I think is so important, that even if we're just scientists, any act that we do, anything we do is political, because as you said, just by reviewing or choosing a reviewer, I think that is already a political act. And so there is a lot that we can do. That's just what I wanted to say. Also for the scientist who was very sort of sad about the global situation, I think each one of us can make a difference. I really think so. And I really think that these webinars are important because they tell us that yes, you can. Yes, we can. That's it. Thank you very much.
Thank you so much, Francesca. I think that's a very good note to end at. I'm really sad that I'm closing this discussion at a point where it was really warming up. It would have been great to continue with this, but I would like to thank our panelists first. Thank you so much for making the time, for sharing your personal experiences. I would like to thank IBRO and Tracy for the support, for making this possible. And I would like to thank the ALBA Network, especially the ALBA Webinar Working Group, for the great work that they've done to get these webinars to us this week. It's been an explosive work and we've really learned a lot. And then lastly, I would like to thank the audience. Thank you so very much for engaging with us. We know we didn't answer all questions, but we will try and make sure we get back to you with all the responses. Thank you, everybody, and have a nice day wherever you are. See you next time.
Thank you.